Good evening, Ranjit.
Hi, good evening, Sam.
Great to have you here on Chabit.
My pleasure, my pleasure.
A bit about your lifestyle. Where did you grow up? School, college, and one lesson from there.
Okay. So basically, I'm from Pune, but lived in Mumbai for years. And I studied in Pune. I did my lot of school initially in Mumbai, and then in Pune. So my father was in the IS, so transferable job. So Mumbai, Pune has been my domain of school. What did I learn first in school? Maths is not my forte. I was terrible at maths, so no wonder I'm a doctor.
Okay. And tell us something about your family.
Yeah, okay. So I've lost my parents, unfortunately. My dad was an ex-IS officer. My mother was a homemaker. And so I am a plastic surgeon. My wife is a laparoscopic gynecologist. My son is pursuing medicine right now in Kuala Lumpur. And that's about my
sister.
Oh, yeah. So my elder brother is in the US. He's an engineer, but not doing nothing related to engineering, as always.
Okay.
So he works in banking software.
Wow.
And so that's all. We're two brothers.
Great. Okay. So tell us briefly about your medical journey and one funny incident from there.
So Medico, I was at Bharati Vidyapit Medical College, Pune, from the first batch of Bharati Vidyapit Medical College, which has now grown into big institute, big hospital, whatever. Then after graduation, I joined Tata Memorial Hospital for my masters in general surgery. Tata Memorial Hospital, as all of you know, it's a cancer hospital. But at that time, they used to give a degree under University of Mumbai in general surgery. And then I did my plastic surgery from Armed Forces Medical College, Pune.
Okay.
So Pune, Mumbai. So that has been my shuffle. Funny story, there are a lot of boys' stories which I can't disclose here from medical school. But one thing is there. So ours was a private college and in Pune, and ours was the first batch. So a lot of teachers from the government college, BJ Medical College, which is a very prestigious medical college in Pune, they moved to this Bharati Vidyapit Medical College. And we had a dean from there, Dr. Zogrekar.
Okay.
Terror, he's no more, unfortunately. Terror means terror. So we had a lot of doctors' children in our college, in our school, in our class. And this guy, Dr. Zogrekar, he had taught their parents also.
Oh.
He would come to class and fire teachers, everyone, because everyone was students. And students he would pick up, तुझ्या बापाने तेच केलं, तू तेच करतोय. So this is one of the funny incidents. There are a lot of other funny incidents. Medical school has too many funny incidents, which of course I can't.
Great. So your family is full of doctors.
Yeah. So it's a long legacy. My great grandfather was one of the first doctors from the MBBS batch of India.
Wow.
So this Anandi Bai was the first female, the lady doctor. So my grandfather is almost from that time, from Grand Medical College, the olden days, great grandfather. So my great grandfather, my grandfather, two of my masis, their husbands, so all children, like we are 4 first cousins from my maternal side as doctors. My bhabi, you name it, my in-laws, my mother-in-law, my father-in-law. It's like the odd people out are about 3 of them who are not doctors.
Okay.
So they just pull their hair out when we cousins meet that enough of this doctor yaar, bahut ho gaya yaar, abhi chup karo. So except a psychiatrist, which we need desperately, I agree with him as well. So I think we have all specialties: intensivist, plastic surgeon, gynecologist, ophthalmologist, everyone.
So you all deal in barter or you all pay each other?
So I think we should start a medical college.
I know, absolutely.
It's a good one. Let me put it across to all my family.
Okay, we come to quick gun, Sam. Madhuri Dixit or Priyanka Chopra?
Marathi mulgi, Madhuri Dixit.
Madhuri Dixit, okay.
Yes.
Retire at 40 or keep working?
Keep working. अरे बिंदास जोर से काम करना है, सवाल ही नहीं.
Apple or Windows?
Apple.
Okay. Veg or non-veg? Please elaborate on this.
Strict non-vegetarian. I cannot live with her. Sam knows. So strictly non-vegetarian. Elaborate. Anything moving goes in my tummy.
Okay.
Except human beings, I can eat anything.
And he's managed to convert his...
Yeah, and so I have managed to convert the other side. My wife is she was a vegetarian. She's from a vegetarian family. So of course I converted my wife, my father-in-law, my brother-in-law. Now they have converted, except my mother-in-law. I can't dare to, even ask her. But I have converted all of them. They're all strict non-vegetarians now.
Stick on. That's great.
Strict non-veg. Yeah, actually, the family hails from Konkan. Rajesh, we are Sikkipis, so we are from Konkan, but lived in Mumbai, Pune, but
Great. Okay. So tell us about Refonte.
it is not Refonte, it is Refon. It's a
Refon.
French word, Refon, which is my clinic.
Okay.
So when I started this, so I always wanted to have a place of my own. Everyone wants to have their identity and a place of their own. So I wanted to buy a place of my own. I didn't want to go in a rental place. So it took me a long time to come to a clinic to buy a clinic, to have a clinic of my own. And I wanted to have something related to plastic surgery, something related with R, starting with R with my name. So Refon was the thing. Refon in French means to realign, recast, those who have studied French or know French. So that is what plastic surgery is about, So plastic surgery is not just cosmetic surgery, this is one part of plastic surgery is cosmetic surgery. So to realign, recast, that is what Refon is. So this is my clinic, which is in Lokhandwala above Marks and Spencer. And so there I don't do any operative work. Operative work happens in hospitals, but there I do the non-invasive, non-operative work.
Okay. Where are your where do you practice?
Yeah, so I do all my cosmetic surgery work at Sujaya Hospital, which is very close by, and Nanavati. I'm into bit of cancer reconstruction, the plastic surgery part of cancer reconstruction. So that mainly I do at Nanavati.
Okay. So has plastic surgery become normal compared to earlier?
Normal, abnormal, what do you mean?
Earlier it was a very big thing to do plastic surgery.
Well. So again, you're confusing.
Okay.
So you are confusing cosmetic surgery, or cosmetic surgery is not a word. The word is aesthetic surgery. Okay. So you're confusing between aesthetic surgery is equal to plastic surgery. No. Plastic surgery is one broad specialty. Now all of you will wonder, ye plastic kya hai? What is this plastic? Is there a use of plastic? No. It comes from a Greek word called plastikos. That means to mold, to reshape. So that was in my mind when I formed Reform. Okay. So that is where it comes from, and then it has multiple specialties like congenital deformities that happen at birth, treatment of those. You have burns, you have reconstructive surgery, broken limbs to be replanted, immediately. That is microvascular surgery, and then you have this aesthetic surgery, which is glamorous and everything is normal. This is a proper discipline of surgery, and everything. There's nothing abnormal. It's normal.
Great. Okay.
Normal in the sense people are becoming more aware of their looks, so people want cosmetic surgery, people want to look better in terms of body shape, in terms of face, rejuvenation, all. So yes, the awareness has increased. Yes.
Great. So what are 4 areas of the body you work with?
Okay. So I will go in the sequence: face, tummy, chest or breast or chest in both men and women both, and thighs. These are the main parts of the body that everyone would be concerned, and this is the core thing that we work on.
So what do you do in each of these parts?
Each of this. So basically, it's in the face. So it's about a lift and giving a younger look or correcting a deformity. That is what it is. So face mainly, with aging, your face sags, and you have to have a lift to the face. That is one section. Some who want to, even a young face wants to become even better. So we can address certain issues. It does not mean everything is done by surgery. There are a lot of things which can be done non-surgically, where you have this botulinum toxin. I'm not using a commercial name, botulinum toxin, which is called Botox, which is a commercial name, but there are several brands available. Then you have these fillers, hyaluronic acid gels, to a facelift surgery. So every group, every condition or every appearance can be changed as per the condition. Okay. So that happens in face. Then you have hair transplants, which I have not done. So my patients, they come to me for hair transplant. Arey, kiske paas aa gaya? But then I say, boss, मैं करके दूंगा. No one as good as me. आ जाओ. And they have seen some of. They are generally references from patients. So but they're happy. Coming from top to bottom, then the chest is like women wanting augmentations of the breast, reduction of the breast. Men, I do at least 4 to 5 young boys who have gynecomastia, which is like prominent breast tissue in young boys or men, which is a big embarrassment. And so I do at least 3-4 in a month. Coming to the tummy, like everyone wants to have a flat tummy. Women want to have, men want to have. Okay, so that's one. Then shape of the thighs, that determines your overall proportion. So that is another area where we concentrate. So basically, our specialty is for sculpting of the body.
Okay.
Okay, we are not into weight reduction.
So now coming to maybe they have a lot of these, like there's this Pretty Slim and all these, they have this weight reduction where they use laser to reduce weight.
Yeah. So one thing you have to bear in mind, today's society is prevalent with quacks and non-qualified people doing all sorts of things and so when people come to or they talk to us, they talk loosely, अरे उससे सब मर जाते हैं, उसे ऐसा होता है, वैसा होता है. No, because things are going in a wrong direction and things have fallen into people who are unqualified, and they're absolute quacks. And big companies come out with machines which temporarily may give you a little bit results, but finally you have to follow proven principles of science, which we have studied. Now, I have done my MBBS, MS General Surgery and MCH in plastic surgery. So, this is what a qualified plastic surgeon is. Or on the other side, you have dermatologists who are MBBS and MD medicine, MD in dermatology. So, they are proper, we are like proper qualified people. So, you should remember to have advice from a qualified, so just having one golden principle of, you talked about Pretty Slim for weight reduction, all that. One golden principle is lifestyle. So, rest surgically or other things, machines and all comes later. Lifestyle in terms of good diet, a healthy diet and exercise. There is no substitute for that. Okay. So, 70% exercise or 60% diet, 40% exercise, that's a different story. Right? No substitute for a healthy diet, a healthy lifestyle. So, this is what it is in the society today.
So, there's a lot of things about, this is one doctor I spoke about where they suck out your belly fat.
Yes.
So, there is also somebody who said like if that molecule gets into your bloodstream.
Oh, these are things of the past. So, yes, now you're talking about liposuction. Yes. Liposuction is sucking out of the fat. Essentially, it is a body contouring procedure. So, you will lose lot in inches, okay, and you will have a contour to the body, shape to the body, but there is a limit. Now, we have adventurous plastic surgeons who will remove 8 liters, 10 liters. So, normally it's in liters always, and that doesn't transform into weight, that you remove 8 liters of fat, that means you will lose 8 kg. No, you will just lose inches. Normally, the golden principle is our blood volume is 4 to 6 liters. So, never cross the blood volume, so that's very safe. This is what I practice. Okay. Now, initially when this procedure started, people used to use big, thick tubes, we call it cannula. These are like metallic tubes, of course sterilized, and they suck out the fat. They used to be very thick. So, the big globules of fat then used to have embolism, and then when you remove large volumes of fat with these big tubes, which used to happen previously, then the fat would go into the bloodstream and then you had those complications. Okay. Hardly seen, rarely seen these days. Not happens, doesn't happen. Bariatric surgery is the surgery for morbid obesity. What is morbid obesity? Your body mass index is close to 40. Body mass, everyone knows BMI, body mass index. So, if it is close to 40, 38, 40, then you need really something, because that is a disease. Okay, morbid obesity is a disease. So, you need to cut down on your weight. How will you cut down on your weight? They cut the stomach. The stomach is cut. So, even if the mind says eat, you cannot eat, and then you almost starve. And then you come to a body proportion, and then that all those problems of morbid obesity, which are almost life threatening, you are saved from that. Okay. So, that's a totally different ball game. Plastic surgeons don't do bariatric surgery. They are done by bariatric surgeons or general surgeons who specialize into bariatric surgery. We are only body contouring surgeons. So, ideally if body mass index BMI is about 32, 34, our procedures are contraindicated. We should not touch a patient. Okay, we have to be, or else even if someone is crossing that body mass index, then limited volume, say flanks or a little bit on the thighs, just to give a little bit shape. Yes, that can be done.
So, you can get custom six-pack also now?
You can, but you have to earn your six packs. You can't just say, I will go to a plastic surgeon and get six packs. No, if you have, that looks atrocious. What they do is they inject fat, fat here, fat here, and that looks atrocious. That looks very bad. So, you have to earn your six packs. You have 2 pack, 3 packs, a little bit here, then yes, the contouring, yes, you can earn it. You earn it, and then we can support it and augment it. Yes.
So, most of these procedures are like cost you almost like more than a...
Not really. Okay. It all depends on the affordability, the time that the surgeon, how much effort I am going to put. So, it all depends on what category you choose in the hospital. So it can be customized. Not that you can go too high or just fall down, but of course these can be customized. It is about 2 hours of surgery, 3 hours of surgery. You do in a good hospital. You choose for top room, as you would do it for a hernia surgery or a bypass surgery, where you choose the top doctor. Similarly. So it's nothing hard and fast that it's expensive.
Okay. So does Mediclaim cover this?
No. Cosmetic surgery is not covered under Mediclaim. No. Out of question. No. It's all, we call it Nakhra and Natak surgeries, which we cater now. So, but still.
Okay. So what is the process for a customer? When a customer comes to
Patient. We don't
No,
get
I wrote patient and customer.
Patient.
So patient.
We get
comes
patients.
to-
Customer. My God. I'm not in a dukan here. So it's simple. So I'll be a little elaborate on this, Sam. We get, varied people, but some people who are, some patients who are very, very specific. I want this, and they are Google doctors. So, it's a heck of a task to convince them that I can do something, and I have to give, as a plastic surgeon, a realistic solution. That someone is okay, and you want to become Madhuri Dixit or Amitabh Bachchan, that is not possible. So you have to tell them that this is possible, this is not possible. Some just sit like a lump. You tell me what I need on my face, or on. I can see 1,000 things, and I can't offer the solution. So first thing is, a person comes, you have to consult. So I have to fall into that framework, what the person wants, how realistic are the expectations, and how much I can deliver closest to that realistic expectation. Once you have a balance there, only then the things will be successful. Pre-op counseling is extremely important. What you can give, what is not possible, the post-op period, and the possible complications. See, any operation, 1 or 2% chance of complication. So people ask me, what can happen? I just ask them one question: what can happen in a flight? Anything can happen. So that way, surgery, dental procedure also, you can die. You have a reaction to local anesthesia. I'm not scaring you, please. But anything can happen. Yeah. But you don't talk of these are 1% rare cases. So, but then anything is with complications. So you explain the whole process.
Celebrity clients.
Sorry, I can't disclose.
No, don't give the names.
No, they do. It's not, see, again, it is not just for celebrities. It is for anyone and everyone. Okay, right from young boys and girls to a elderly woman or a man who has something called as a body self-image. All of us have a body self-image. Now, something from that body self-image which appeals you and which you think that, yes, I need this correction, this is really bothering me, and if I can deliver that, why not? So I have done breast implant on a 16-year-old girl, consented by the mother. 16-year-old, to a breast implant on a 60-year-old lady. She had daughters of 28 and 30. The husband had promised her to gift her breast implants on her 50th birthday. That didn't happen, but she got it done at her 60th birthday. They were happy. So another story is another young girl with breast implants. She is like from Marwadi family. The father and daughter came to me. And he said, initially the father said, I said, hey, ye sab nahi karte. The typical, the conservative, orthodox mindset, hey, ye sab apni bas ki baat, nahi karna hai. Then he said, I found my daughter sulking, family functions, she's not, there is something wrong with her. Then, yes, I agreed, and we'll do this surgery. I did the surgery. The father came back for the last follow-up. The father came with the daughter and he said, you have changed my daughter's life. She has changed completely as a person. Young boys with this gynecomastia, you change their body contour, it makes a lot of difference. So it is for anyone and everyone. Of course, celebrities, yes, wannabe Bollywoods, wannabe models, they have certain body features to be augmented. Yes, that can be done. So it is for anyone and everyone. It's not like only celebrities.
Now coming to one, this we can delete from the camera, but coming to one very prominent top family of India. He lost a lot of weight and then gained that weight back again.
Yeah. So I'm not the person for.
No, but what is the story, the backstory?
Well, he must have done something radical in terms of diet. See, diet. I have lost 17 kgs weight. So this is about 5 years back. I was 86 kgs. I came straight to about 68, 69, and I maintained about 70, 71. I am into a lifestyle, but into exercise, but my diet was atrocious. Tomorrow morning, 6 o'clock, I'll be in the gym here. In the morning, I'll be in the gym no matter what. And I controlled my diet, and everything came back to normal. So, but if you do those radical stuff, you can't maintain it for the rest of your life. Your diet and your exercise should be something which you can follow for the rest of your life. This is one golden principle. So, this great man must have, employed so many people, and he lost weight, but he could not maintain it forever. You should have something which you can sustain for the rest of your life.
So, your hobbies?
Photography. Give me there camera there. I can click everybody's portraits. I'll forget who Sam is. I'll just start clicking. So photography is my passion, absolute passion. From wildlife, little bit of glamour, anything and everything. Someone wants मेरा portfolio बना के दे चल इधर studio hire करते बना के देता हूँ. So anything. So in my family functions, in my society, in my hospital, whenever I get a chance, I click. I have a lot of equipment, higher end equipment, and so I've done a lot of birding. I do a lot of birding, and bird in flight is my passion. So I do a lot of that, and collection of fountain pens is my absolute
Fountain pens?
absolute passion.
Okay.
Absolute passion.